Texas health officials are reassuring the public after 2 confirmed Texans were on board a cruise ship tied to the deadly hantavirus outbreak overseas. Officials say the passengers are back home in the U.S. and so far have not developed any symptoms. Devon Roming joins us from the Med Center. Devon, what are officials saying about the risk to Texans?
Well, officials say the 2 Texans who were on board the ship are being monitored at this time. But the good news in all of this is that they had no sort of contact with the people who fell ill on the ship from the virus. The outbreak happened aboard a cruise ship that traveled near Antarctica before crossing the Atlantic Ocean. And according to health officials, 3 people connected to the ship have died. Texas Health and Human Services says 2 Texans were also on board, but both left the ship before the outbreak was identified. Officials say neither person was experiencing symptoms and both are now being monitored for their health at home. Now, we spoke with a Texas man who contracted a different strain of the virus way back in 2005 when he was just 27 years old after a trip to New Mexico.
I remember telling my wife that I thought my brain was going to melt. It was just so terrible. And then as that progresses, it does affect your lungs. And eventually, within a day or two, it really affected my lungs. And when I went to the doctor, they transferred me over to UMC in Lubbock, which is a Texas Tech hospital. And I was put on a ventilator for, I was in the hospital about 2 weeks, but I was on a ventilator for probably 10 or 12 days of that time.
Doctors say the virus is not easily spread person to person and is most commonly linked to exposure to infected rodent droppings or urine. The World Health Organization says most people will never be exposed to the hantavirus, but experts are still closely monitoring the outbreak because of how serious the illness can become. In the Med Center, Devon Roming, KHOU 11 News.